Respected dignitaries on the dais, especially our family friends and colleague, Vice Chancellor, Dr. Nandakumar Reddy Garu, been known to each other for a very long time, and very kind of you to come for this occasion. And though you are very busy, thank you very much for making time to come all the way to Mahbub Nagar. Congratulations graduates, postgraduates, and special congratulations to proud parents. Your hard work, dedication has come and produced the best result. As my brother Venkat Reddy said, SVS is the best, because you can see Vice Chancellor is from Mahbub Nagar, CM is from Mahbub Nagar, and the graduates, postgraduates are from Mahbub Nagar. And you are the best. Because we get the best people in SVS, that's why you become better. And we created the environment, teaching atmosphere, so that you grow to the top. As Krishna Devada said, wherever we go in the society in Hyderabad, the last year I was in London, with so many people from SVS, we can't recognize him because more than 25 years since we started this, they come and say, hello sir, probably you don't remember me, but I am from SVS. One of the anesthetists was heading the critical care department in Leicester, in UK. And he was saying about many people are doing extremely well in US as well as in UK. I think last year there was a reunion of 99 batch, first batch of SVS. And you name everyone, all of them are successfully settled. This is a big inspiration for graduates and postgraduates. As brothers just said, you are supported by your department, your HOD till now. Now you are independent. You have to make decisions on your own, probably for some time. So you have to be very careful what you do and what you get on in life. And of course, most of you should specialize in super specialty, and like many of the faculty here should come back to SVS and work here sometime. We will be very honored and proud to be with you again in here. And as I said, I think the key to successful doctor, I keep saying every time, you have to be, you should imagine yourself in the patient's shoe. What would you do if you go to a patient, as a patient to a doctor? What do you want from the doctor? Because especially if you are a super specialist, what happens is most of the patients might have seen many doctors not knowing what their problem was, not able to explain or understand their disease. And everyone said that you have to listen. It may not be the actual problem, the disease problem that's troubling the patient. It may be something else which is very worried. So you should counsel, empathetic with them. So what you have to do is, when they come to your consultation room, make them sit down, make them relax for some time, start off with something, common thing, like where you come from, what do you do, how many children. Then you get acquainted, and then go to the disease process. You might have seen nowadays people come with bunch of investigation. They get so many investigations, and they couldn't find anything wrong with them. Any patient comes with big packet of investigation means there's nothing wrong with them. But they need reassurance. In a way, it will calm them. It will assure them that they will be all right. So it's important to become a good doctor. You should be a good person, a good listening person, understand the patient, what they want. So it's important to listen. Unless you listen to them, you don't know what is there in their brain, what exactly they are expecting from you. That's the key for success. And as Vijayarajan said, I think it's a continuous process. You can't stop learning. Every day is learning. And the best teacher for you, you know who is the best teacher? Your own patients. They teach you so many things. And you should keep yourself by attending conferences, presentation, and publication. To publish one paper, you have to put so many hours of hard work going through the literature. What is the latest literature saying on that particular condition? So it is important to keep update yourself. And Dr. Suhasini was saying about the projects. They are original research done in SVH. We're very proud of those students and congratulate them. And we published more than 100 papers last year in listed journals, original research. So everyone should participate in research. And research is the way, future. I think between you and me, my elder sister diagnosed with lung cancer. And very difficult to treat lung cancer. And the treatment sometimes is expensive. She is undergoing immunotherapy. Very expensive treatment. The entire course will cost about 80 to 90 lakhs. Because the drug is manufactured in America or Germany, we have to import. There's so many taxes, so much of overheads. So some of you should dedicate yourself to find solution to many of these problems. Maybe a new drug for cancer, new drug for antibiotic resistant bacteria, which is the killer present situation. Maybe arthritis, so many conditions. So dedicate yourself to innovative medicine, and you should be the leaders in medicine in the world. And Vijayarajan was saying about robotic surgeries, artificial intelligence in the future. I think we cannot get away without knowing artificial intelligence. I think Venkataraman brother keeps saying about ChatGPT and so many perplexity. You just type it, you get all the information. And robotic knee replacement, when we started in 80s, we were the first, among the first in PGH Chandigarh to do a knee replacement. Things have changed dramatically since then. We used to take about 3.5 hours, keep the patient in hospital maybe 10 days to 12 days till we remove the stitches. The technology changed. Now robotic technology. Because most of the implants were designed European American patients. We don't know they're going to fit to the Indian population. But the new technology, we can personalize your own implant, your own knee replacement. We can do a CT scan, upload onto the robo, it will decide which is the best implant and what is the best position and where it has to articulate. So the technology has changed. So every implant or maybe in the future every medicine can be individualized, personalized. And this is the future in all specialties. So some of you should take up research and part of the research, profession, part of the research. And I keep saying that unless you enjoy your profession, you should enjoy when you're doing surgery or doing a procedure, you should not feel stressful. If you enjoy, you become very successful. That's a key for a successful profession. And one word about SVS, we started in 98, hospital started in 98, 99 first batch came. Now, one of the top hospitals in the country, we can say, because we have 3 Tesla MRI scan, which is the latest one. It will take about 5 minutes to do brain scan. Previously, some of you had a MRI scan, will take about 20, 30, 40 minutes. But you can get a scan in about 5 to 6 minutes. Children, we used to anesthetize them to do MRI scan. Now we don't need them. We can do them directly without anesthetizing. And a CT scan, we have the latest CT scan. The recent addition is cath lab. Philips cath lab, which is the latest one, and you can have wonderful experience with minimal complication. Apart from all this, can you imagine what would the cost in Hyderabad and in SVS? SVS has the better MRI scan. The cost is about 3,000 to 3,500. Without my brother's discount, most of the time there will be 50% discount. In Hyderabad, same MRI scan will cost 18,000. In Apollo, it will cost 18,000 rupees. CT scan will cost 50,000. Angio, of course, cost a fortune. So, what I want from the parents, from the students, so if you have a poor patient or anybody around, you should inform these facilities about SVS. We are doing a great service with all of you, providing this care. This is, people say it's a corporate hospital for poor people. And you name it, everything is there. So I wish all the graduates, postgraduates to be successful in life and to build institutions like SVS. Come back and tell us. We will be very proud of you. Thank you for giving me this opportunity and coming over, spending time with us.